Thanks, Alana. That's the recording started, Chair.
Thank you. Welcome everyone to this meeting of the East Lothian IJB Audit and Risk Committee on 24th March 2026, which is being held remotely. I will now pass to the clerk to read the data protection statement.
Thank you. This meeting is being recorded and will be made available as a webcast via the Council's website in order to allow the public access to the democratic process in East Lothian. East Lothian Council and the NHS Lothian are data controllers under the Data Protection Act 2018. Data collected as part of the recording will be retained in accordance with the Council and NHS Lothian's policies on record retention, and the webcast of this meeting will be publicly available for 5 years from the date of the meeting. We have apologies today from Councillor Finlay, and we also have apologies from Patricia Cantley, and Patricia has nominated Jonathan Blaseby as substitute. I'll now take a roll call of committee members present. Elizabeth Gordon.
Present.
Councillor Akhtar.
Present.
Jonathan Blaseby. And David Binney.
Present.
Thank you. Can I check whether there are any declarations of interest to be made? Don't appear to be any. Also, just before we begin, just to note a change to the agenda order today, and that's because our Chief Internal Auditor can't attend the meeting until a little bit later. So we will hear items 6 and 7 after item 2, just to give a little bit more time for Mr. Steenbank to arrive at the meeting. Okay, to move to the first item, Chair?
Yes, that'd be great, thank you.
Item 1 are minutes for approval from the meeting of the Audit and Risk Committee on the 2nd of December 2025, and also any matters arising.
Thanks, Rebecca. We'll just go through the minutes now. Can I ask, looking for everyone to agree they're happy that the minutes are a true record of the meeting. Does anyone have any comments on page 1, page 2, page 3, page 4, page 5? No, looks like there's no comments, so it seems like everybody's happy to be it's a true record. Can I ask if there are any matters arising which are not otherwise covered on the agenda? No, thank you. Okay, I think that concludes that matter, thanks.
Thank you. Item 2 is the action log. And just to note that Mike Porteous is going to give an update for the matters at action 3.25 and 4.25.
Oh, Mike, you're on mute.
I'm forgetting to, sorry, forgot to take my microphone off. Right, so item 3.25 or action 3.25. So I've had some productive conversations with IJB Equalities and Engagement Officer on this. So she's been compiling a database or a data set of sort of 5,000 plus sources of community feedback information that they've been gathering over the last year, and she's collating that in various different ways. But that's allowed us to sort of do a comparison and a contrast with or compare and contrast the views of the public on our strategic plan and our proposed programme of efficiencies. So we've seen evidence that the public want to, are keen to see prevention and early intervention in line with the strategic plan. And so, you know, we have got Invest to Save proposals within our efficiency schemes that relate to that. So we're taking on board, or we're trying to match up some of the comments from the public in what we do in terms of delivering our business. And we're currently working on a community engagement document, and that will explain how our finances work, how we approach setting a balanced budget, and the financial challenges that we have ahead. So there's a lot of work has gone on, a lot of work is going on to try and address sort of information flow between the IJB and the Health and Social Care Partnership and clients and patients and the members of the public. I don't know if anybody's got any comments or questions around that, if that deals with that action, or if there's anything else that we need to do.
Thanks, Mike. Yeah, I was very impressed by the great work that Kate Thornbank and colleagues have been doing that we heard about at the last business meeting. So thank you for that update, and that sounds good, particularly regarding the financial information flow. See, Shameen wants to come in. Sorry, Councillor Akhtar, sorry, you want to come in?
Yeah, no, thank you. No, Mike, that sounds really good about the feedback that you've the 5,000 comments and feedback, because we got that report, that full report to the IJB. I just wondered, and I'll leave this with you. I know there's been a wider piece of work around the local improvement plan for the whole of East Lothian, and I know that health and social care partnership will be part of that, and they engaged. They had about 25,000 levels of engagement within that plan, and I just wondered it might be useful just to get a reference of that. I haven't seen the actual the outcome of that yet, but one of the objectives of that plan is going to be tackling health and well-being. So just for information, to make sure that we're collating all information around the views of residents around East Lothian, that might be worth something to kind of have a cross-reference and just to use in our work, that recognitions of that and we're using it.
Noted. Thank you, Shameen.
Thanks. So I think the proposal was to close this item on the action log. I mean, obviously, it's really clear that this is an ongoing piece of work that sort of informs how the IJB do things going forward. So I'm personally content to close that. Is everybody else content to do the same? No comments?
Yep.
Okay. Thank you.
Thank you. So I'll move on to 4.25, which is around to consider and arrange an appropriate setting for detailed discussion on understanding demographic pressures and levels of unmet need. So it's assigned to David and Huda myself. So I'll provide a brief update, and David can hopefully come in if he's got anything to add. But when we spoke, we realised there was quite a lot of information out there on demographic pressures that's currently available. So there's the demographic pressure risk that's on our risk register, and all the information that goes is associated with that in terms of the controls and so on that we've got identified there. The revised strategic plan has got a section on demographics within it, and we have, I know from being there, we have discussed demographics, and we have had slides on demographics at the recent development days over the last year or so. So there's a sense that there's a lot of information out there on demographics. I don't know if that's enough to answer this particular action. I don't know if David wants to say anything else, or if there's felt that we still need to do a bit more.
John, did you want to come in?
Well, yeah, obviously I'm new here, so I'm not part of previous discussions, but just on that, Mike, I guess, you know, for me as an IJB member, you know, it's always useful to have discussion, and if that's in a development session or otherwise, on things like these pressures and demographic change, and in the sort of community around us, and what that means for the IJB and service delivery. I mean, it's not for me about, I don't need a pack telling me or giving more information on proving that is happening. I think for me personally, it's around what is the effect on our service delivery and what we need to do to prepare for changes, and to the extent they're happening now and they're visible, they're real, what are we doing to affect change, to meet that change in the demographics, if that makes sense. So I think it's always a good thing if we're going to have that in development session and we've got time for it. I think it's good, but it's not about, oh look, here's some data around what's happening in terms of that demographic change. It's what are we doing about it? What do we have to do? What are the decisions we may need to make coming up in the next 6, 12, 24 months, 5 years? That would be my comment on that.
I mean, just a brief response. So, I mean, I guess that's what one of the things we're trying to do by presenting the medium-term financial projections, and aligning it back to the financial situation and what the strategic objectives are for the IJB, and how do we marry these things up, and demographics will be part of that, as you say, John. So we are trying to do all that in the background and in the forefront when we bring the information to the IJB. But so I don't know, as I say, if that deals with this action or if there's more.
But like I say, Mike, I think the conversation's often about, for me anyway, it feels more about it's explaining that there is demographic change happening rather than what it means and what do we need to do and what do we actually need to plan for now. That's my point, really. What are the changes we're going to have to put in place? I don't feel that we get into the weeds of that in any depth. It kind of seems like a future state we need to deal with at some point. That's how it feels to me anyway. So I think if there is a development session on this, it's probably a worthwhile planning exercise. Or Shameen, I see you're coming in now.
Yeah,
Yeah, no,
thanks, Shimeen.
Yeah, no, I hear what you're saying, Jonathan, and maybe it could be something that's weaved into all of our development sessions. So I remember having a conversation with David around kind of longer term and what the plans might be in, for example, areas that are rural, where we struggle with more social care. And I've seen a table where out of the 32 geographical areas, East Lothian had the highest level of people, I think over the decade, highest level of aged 75 or over. So it might be something that's when staff are presenting papers on transformation or changing services, that they're just a reminder of what the demographics look for us in East Lothian, and they're very different from some of the other places of the things that I go to, where we've got population growth and other areas are looking at other challenges and demands and very different from ours. It might be something that it's on the radar all the time through development sessions and strategic planning group conversations, that it's not left off, but it's incorporated in other ways.
Thanks for that contribution as well. David, do you want to come in now?
Yeah, thanks, Chair. I'm just reflecting on what Jonathan and Shameen have said. So obviously through developing the new strategic plan, I think one of the key factors of that has been to try and tangibly look at what actions can we take in terms of that strategic plan, taking into account demographics and the change that we know that is going to happen. So rather than it being that academic exercise, it's okay, what are our priorities going forward and how do we marry that up with strategically what the priorities are for the IJB? And I think that's been captured in the new strategic plan. I think the translation of that from a strategic plan into almost the SPG and the delivery groups in terms of the program boards, what are we actually going to do? So as Shameen has suggested, then as the program boards feed back to the SPG and have the discussion about their own individual component programs of work, there is that acknowledgement and recognition about, okay, the demographics, what's happening and what are we doing under those individual pieces of work, so that we can have a conversation. So let's just make it as an example around primary care. So the new primary care program board, what's the impact of demographics and on primary care, and what are we going to do to mitigate the challenges going forward, and what are the tangible actions, and then how do we weave that as a key component into each of the program boards and actually come back with a specific response in terms of the challenge around demographics, rather than just having a kind of theoretical conversation about the risk and the growing population and what that might look like in 3-5 years time, because I think we know the numbers now. We've had them quite extensively, but I think it is that bit about, okay, so what do we do next? And I think maybe feeding that in through the program boards with a specific ask that when we're bringing it back through the SPG, we respond in that context.
Thanks, David. That all makes a lot of sense, and the fact is that it obviously does transcend everything that we're doing going forward. Just in terms of this committee, are we content to close it off, having heard from David about the plans in terms of making sure it's taken forward in the rest of the IJB's work? Sorry, David, you want to come back in?
Sorry, I was just from an action perspective, I'm happy to take that back as an action to each of the chairs of the programme boards and say that we've had this conversation here and ask that when we are presenting anything through SPG or up to the IJB that we are cognizant and we explicitly recognise the impact of demographics and our actions in that context, just to kind of make sure that we don't miss it from the link between this committee and the programme boards and SPG, etc.
Thank you, David. That sounds great. I'm happy with that. Is everybody else happy with that? Great, thank you. Okay, so that item can be closed off on the action log with the understanding that David's actioning that going forward. Thank you. In terms of the rest of the action log, we had at 6:25 that Duncan was going to speak to John about examples of good practice from other IJBs. John, is that something that you've had a discussion with Duncan about yet? Sorry, John Boyd.
Yeah, no, we've not had the opportunity to discuss it. We've actually got meetings scheduled as part of the annual audit of the council. We have quite regular engagement with Duncan, so we'll pick up with Duncan as part of that.
That's fine. Okay, so Rebecca, could we just update that we'll get an update at the next meeting on that, please? Thank you. And number 7 on the action log was a question about information being sought on funding to pay for the requirement to provide breaks from caring. I noticed that is mentioned elsewhere in the papers, and I understand that there's still currently no update from the Scottish Government in terms of the funding for that. Are people wanting to leave that on the action log as a reminder to discuss it at a future meeting? Shimeen.
Yeah, it'd be worth just leaving that on, because I know there's the right to breaks and timescales for support plans. A consultation has been launched that was published on the 13th of March, and we might want to kind of take cognizance of that. So it asks quite specific questions, definition of a care break, etc. So I think that would be useful to have a link to that for members to be aware, and as an IJB we'd want to respond to that consultation.
Thanks, Shimeen. In terms of the IJB responding, is that something that officers are already dealing with? Do you know? David.
I don't know offhand, but I've just scribbled a note to follow up, and we'll check in terms of that consultation. So Shimeen may have a.
Yeah, it's just recently come out, so it's just come onto people's radars, and the closing date's the 22nd of May.
Thank you for that. So David, are you able to take that forward?
I will do. Shimeen, if you've got a link to the consultation, that'll be helpful, but I'll pick it up and we'll obviously draft something and we can share it around for people for input.
Thank you, David. David Binney.
I understand discussions are taking place with officials with a view to responding to the consultation, and the idea of keeping it as a live action is the right one.
Thank you, David. Okay, so we're keeping that on, and we've got a bit of work potentially to do there. So thank you for that, everyone. And then number 8 was the reviewing the format of the risk register, which I think we're going to be discussing during this meeting. So shall we leave it on the action log just now until it's resolved, Mike?
Well, I guess I can share where we've got to. Duncan and I have spoken about it, and we've got ongoing discussion. We haven't met about it yet, but we've spoken about it. And I think what we'd probably propose is that we circulate once we've landed on an alternative or an alternative format. We would look to circulate that before the next risk register meeting, or the next Audit and Risk Committee meeting, with a view to getting people's views in terms of using that as an alternative to the risk register that we have at the moment. So if that's acceptable, then that's what we'll do.
That sounds good to me. Thank you. Anyone else got any thoughts on that? Okay, that's fine. Thank you, Mike.
Okay, thanks.
So I think that's the action log dealt with. Thanks, Rebecca.
Thank you. So moving on to item 6 now, which is the 2025-26 risk register review, and Mike is going to present that report.
Thank you. So the purpose of this report is to provide the Audit and Risk Committee with an update on the status of the risks on the IJB risk register, and to allow us to have a discussion around any changes that we would like to make to those risks. We continue to have six live risks on our risk register, 2 that are very high ratings, 2 that have high ratings, and 2 that have medium ratings. So just as in the past, we'll go through them one by one, and happy to have any discussions around them. So the first one that we've got on a very high risk rating is risk 3924, which is around the financial resources being insufficient to sustain the strategic plan. Members will recall at the last IJB that I updated them on the Q3 financial position, which was an overspend year to date at the end of month 9, and a forecast overspend for the IJB for the year end. That has been updated with the month 11 IJB information, and we're forecasting an increase in our overspend. So we do have a significant overspend in this financial year, largely around the health delegated functions and prescribing and GMS. We know from previous meetings and from development days that the medium-term financial projections are for a significant gap year on year in our financial position going forward. So on that basis, I would recommend that we leave this as a very high risk rating. Happy to discuss.
Thanks,
Okay.
Mike. Does anyone have any questions on that one? Jonathan
So
Leslie?
is this for conversation at the meeting on Thursday, or do we talk about it here? I mean, it's kind of a question of what we do at this committee in terms of financial stresses and strains. I'm not sure, Mike. I mean, are you gonna? Because I think you've got a paper on Thursday, haven't you, talking about this? I guess I don't know. It's only because to repeating what we're going to discuss at the full IJB. I don't know. I mean, I guess my concerns are really around where we get where are we going to end up this year, right? I mean, from what you said there, there's obviously there's a major concern that we might be in deficit this year from what you just said there, but I don't think that is what we had previously. Well, sorry, you've raised a risk before, but I felt that we were going to get to balance this year. I felt was where we landed before on this. I don't know if I'm mishearing what you're saying now. I understand the risks in the future, but in terms of this financial year, is that still?
Sorry, John.
Yeah, no, sorry. Yeah, so I've sort of rambled a bit. I'm just kind of I'm really clear on my thinking about what the conversation is in this meeting around the risk to this year's position.
So I guess just to expand on what I just said, then I suppose I was using this year as an example of the pressures that we do have and the risks around our financial position. We will break even this financial year, and that is as a result of NHS Lothian contributing additional funding to our financial position, because they are going to break even and they are therefore in a position to do so. As a standalone entity, we have a significant overspend in this financial year, and we know that our projections for our medium-term financial plan in future years, albeit before we identify efficiencies of things, is a cumulative year-on-year overspend or year-on-year financial gap going forward. So I was proposing that in terms of our risk rating, we continue to see this as a high risk in our ability to deliver our strategic plan. The papers that I bring to Thursday's meeting will be about how are we going to set a balanced budget for next financial year, bearing in mind the efficiencies that we need to deliver, and what does that mean for the IJB going forward. And also an update on the medium-term financial plan, which again will show some of the challenges that we're facing, and will, I suppose, underpin what we're trying to show here as it being a high risk, a very high risk. Does that make sense?
Yeah. So basically, yeah. I mean, given that so that's consistent what you've said before in terms of getting balanced this year. I guess for this particular risk factor, I mean, because we're already, I mean, this is actually only 6-7 days away from the year end, or so. I mean, essentially, you can almost bifurcate this risk here, couldn't you? Because I think what you said, we are going to get balance this year, so it's not a very high risk for this year, because you are going to basically get. It sounds like NHS Lothian will make up the difference on their overspend, and therefore we will get to break even. But the risk remains very high in terms of the forward-looking piece of this. So I guess that's the only. Whether I'm not saying necessarily rewrite this, but it kind of doesn't read like that to me in terms of that 3.3 at the moment. But you've explained it very clearly. Thank you.
Yeah.
Thank you.
Thanks, Mike. Yeah, I think probably because the risk register in its sort of slightly simplified form, while we try to figure out the reformatting, doesn't have quite as much information as the previous version did. But I think everything that Mike's explained makes sense in terms of leaving it as it is just now. So I'm content with that. Don't think anyone else is suggesting they're not. So thanks, Mike, for that one.
Okay, I guess that's what Duncan and I will be looking to try and improve on is the presentation of the risks in the risk register, and how much information that requires us to sort of put forward in the risk register. So I'll move on to the next very high risk, which is 3925, and that is that operational resources may be insufficient to deliver the strategic plan. And I guess the message is much the same, in the sense that the drivers of this risk remain the same in terms of the pressures that our services are under. Care at home, primary care, and disability services, they're all operating under significant pressures at this point in time. We've used time bank as a sort of theme, if you like, to highlight some of the challenges around the operational resources that we have or don't have in the community, and it was just to highlight that we still don't have a finalised plan for the decant of this facility, and the work that needs to be done on that over the next year. And I think that's the second or third time that I've said that. So we are struggling at times and in places to just to get things moving and make sure that we are delivering our business as best we can. So again, I'm recommending that this stays as a very high risk.
Thanks, Mike. So, Shameen, you want to come in?
Yeah, no, thanks for that. I agree with the previous being very high risk, and this one as operational resources being of high risk as well. So I think it's important for the public also to be aware of the risk register and the risks that the East Lothian IJB carries. But as you've mentioned time bank before, is there reassurance that you can give that everything's been done to look at alternative options to manage that risk, and staff are supported to manage that risk?
Yeah, and getting the update that I do have that confidence that it's merely just a time thing in them getting the plans finalised and put in place, and the phase work will start then. But it's slipped, and it's slipped a bit more. So it's just about the challenges around getting it started and getting it moving.
Thanks, David. Who do you want to come in?
Yeah, I'm probably keen not to get into too much operational detail in this meeting, but probably just before this meeting started, this will be news to Mike as well, I had an update from the team about the time bank decant to say that we do now have an operational plan as of this afternoon in terms of all the individual clients and where they'll go. So that's now just being worked through with our colleagues from the asset team in East Lothian Council, and with a view to implementing that. So I think positive progress has been made on that one.
Thanks, David.
Okay, if everybody's happy, I'll just move on to the high risk ratings, if that's okay.
Thanks, Mike.
So, the first of those is 4018, which is the impact of partners' decisions, and this is around around the work that we do with our partners and the meetings that we have at senior officer level with the senior colleagues in the health board and the council, and the fact that we discuss the financial and operational issues that are facing all our organisations, all three of us, in an open forum, and we have good discussions around that. And there's good examples recently around the sort of collaborative work and we've put in place with the council to deal with the delay in the transport policy charging process, that the paper that hasn't gone through as we'd hoped it would by the start of the financial year. So we've been collaborating with the council around how we address that. So we've got good working relationships. But I think it should still stay as a no change in this risk, because there are pressures around our partners' organisations and the way that the things that they are having to deal with as much as there are with ours. So there's still a lot of concerns around how all three organisations take their business forward.
Thanks, Mike. I'm content with that. Anyone got any questions or comments on that? No, I don't think so. Thanks, Mike.
Okay, we'll move on to the last one that's got high risk, which is 5220, which is demographic pressures. Again, it's to highlight the impact of the demographic pressures on our business and our services. We continue to experience pressures around those, particularly in areas like the care at home. And I suppose I just wanted to highlight that, we are doing what we can to mitigate these things and to make sure that all the information that's available, we take into account. The joint needs assessment, strategic needs assessment was updating the strategic plan and to make sure that we've got all that information in the right place. But we still have pressures around our driven by demographics, particularly around, I suppose, prescribing and care at home. And so, again, I would suggest no change in this risk.
Thanks, Mike. Any comments on that? I'm happy with that. No, thank you.
Okay. The last two are medium risk ratings. So we've got the risk 5279, which is the impact of legislation, and that's split into three different components. As you'll recall, the first one was around the employer national insurance and the impact of that on commissioned services. And we've been working with Scotland Excel on that, which is our framework for procurement and commissioning. And monitoring the position. Unfortunately, the conversations and the discussions are coming to a point where it's looking like there are additional pressures that will be asked to deal with going forward from some of our suppliers who are saying that they cannot continue without additional funding as a result of the employer national insurance. So we haven't got quite to that stage yet, but there is definitely, it's looking like that's where it's heading, as much as £100,000 of an additional uplift that will be asked for. So that is a concern moving forward. But we haven't concluded those conversations yet and those discussions. So we have to make sure, we'll have to see what exactly comes out of that at the end of the day. The National Care Service was the second one that we looked at under legislation. Now that has actually been renamed as and it's proceeding as the Care Reform Scotland Act of 2025. And as I've highlighted in the report, one of the key components around that is providing a legal right to breaks for unpaid carers. But we don't have any clarity at this point in time on how that's going to be funded or implemented as a policy. So I think there's still a lot of unknowns in that area. And the last one was around immigration, and I've checked with both HR departments and recruitment services in the council and in health, and there doesn't seem to be any adverse impact of immigration policy on our services at this point in time. So I would advocate that we keep that risk as a medium rating, but particularly with regard to the employer national insurance, once we understand the full extent of that, then we may want to discuss that a bit more.
Thanks, Mike. John, you want to come in?
Yeah, so just on that one, Mike, what is the contractual situation? That's a national contract. Is it an annual national contract, and that's why it's coming to sort of bear soon? Is that for 26, 27? Is that sort of how it works for Excel?
Well, it's not a national contract. Scotland Excel we are part of their framework, but not all IJBs and not all local authorities are part of their framework. So there's I guess a choice that the organisations have as to whether they have their own frameworks or a different framework, or they have that framework. I don't want to go into all the details of this because it's been ongoing for quite a while. Obviously, last year was when the employer national insurance issue rose, because we were funded for all our directly employed staff, but not for any externally employed or commissioned staff, if you like, contracted staff, or contracted services. So Scotland Excel took it upon themselves to undertake discussions with all their providers around this. We as IJB CFOs indicated that we did not have funding for this, and therefore we couldn't support any additional costs in that as a result of that particular policy decision. But Scotland Excel have gone ahead and they've had very strict rules and guidelines around how they've assessed organisations, but it appears that that's now come to a sort of a close, or it's coming to a close around certain organisations indicating that they have significant pressures and asking for additional funding. I don't know how that's going to play out. Because we haven't got to that stage yet. But it's been a year in the making, John. So it's dragged on a bit, and it's only just come to a head now.
So we don't. Sorry, maybe I misread it, because I thought IJB commissioning board. I thought that meant a national body or something. But is that us?
That's us. That's our commissioning board. The IJB's own commissioning board, which is a group that put together to oversee the commissioning of external services on our behalf.
Okay, but you're saying there's a risk that there's going to be a significant uplift in their pricing.
Yeah.
Okay.
Yes.
All right. Okay.
Okay. Thanks.
Thanks, Mike. And John, I was just wondering, Mike, should we update the wording of that risk 5279 to incorporate the new terminology in place of National Care Service, just to reflect the new wording? That'd be great. Thanks. So I see Shameen wants to come in.
Yeah, you've just picked up that point, Elizabeth, and just to be clear around that, we support carers' breaks, but our concern is managing the level of resource to deliver that, and managing expectations while we support it.
Thanks, Shameen. Any other comments? Or John coming back in again?
Yeah, but just broad. I don't know if we've finished on discussion in terms of those particular items, but just it's sort of more broadly in terms of, from the IJB perspective, in terms of how we bring these back to the IJB. I mean, that's part of the risk management policy later on, but just as an IJB member, I don't know, maybe I should remember this. I don't remember kind of the important risks we've just talked about, these being how these get brought back to the IJB board for discussion. So there's a few in there which you might say, well, okay, well, maybe we should be talking about those on Thursday, for example. And I don't know, Elizabeth, I can't really sort of remember, to be honest with you, given I've attended every IJB meeting since I've joined, actually having a specific agenda item talking about these risks, or the sort of those that the Audit Risk Committee believes should be elevated and discussed at the IJB level. I don't know if this is the time to talk about it, or maybe I've totally misunderstand the governance process, but that was my question.
No, I think that's a good point, well made, John. Mike, do you want to come back in there?
My understanding, it is a good point, John, but my understanding is that the IJB has delegated that responsibility to the Audit and Risk Committee. But you're right, there hasn't probably been a level of feedback. I tried to highlight the risks in the finance papers that I bring to the IJB, but probably not as not in the context of the risk register. So I think that's a point well made. What I have undertaken to do is to bring a report to the IJB on the Audit and Risk Committee's business in the past financial year, because there hasn't been anything up to now. So as soon as, well, not as soon as, but once this Audit and Risk Committee is finished and I get the transcripts and the minutes and everything from the meetings, I will try to pull all that together into a report that I'll bring to the IJB early in the new financial year. And I will obviously touch on the risk register aspect of that. So that will give the IJB an understanding of what A, the Audit and Risk Committee has been doing on its behalf, and B, what these risks are and what their ratings are at this point in time. So hopefully that will deal with that going forward.
Yeah, and I think that's a good idea. I know you definitely cover the financial piece every meeting, and that's totally okay. I think it's the other pieces of it. And when we look at the risk management policy later, you know, there is a part in there which talks about the IJB has responsibility to receive and review reports on strategic risks and operational risks that need to be brought to the IJB's attention. And I feel that needs to kind of just be looked at. I think from a governance perspective, I think it'd be value. Some of these items here, I'm kind of looking at for the first time, and I think personally, as an IJB member, I think that would have been useful to have a conversation. I think other IJB members might find that useful on some of these, without duplicating the governance and conversations. Of course, understand totally, as ever, there's a governance kind of route in delegation. But if you could have a look at that, I think that's kind of would be kind of good. Thank you.
What we might look at doing is just having a 6 monthly update to the IJB or something like that. Yeah.
Well, I think, I don't want to, obviously, because actually before I'd read that piece of it, you know, I had some views in terms of the format of the corporate risk register, because it did look a bit different to what I've seen on other committees. But I appreciate you've been looking at that and you're going to come up with a different format of some kind which is suitable for the IJB. But things like having a risk owner would be helpful, I think, because it feels almost that you're talking, Mike, and you are the risk owner for all of these risks, and you're clearly not. You're not responsible for them. You are for the finance piece, but not the others. So I think that's an element which I think is useful. And you bring it when it's brought forward to the IJB, it's the owners who can then have that conversation and report to the IJB. So I don't know. There's all sorts of things there. I wouldn't over egg it, because you can overdo these things. Yeah. Thank you.
That's right, John, and you make some good points, and all that information's in the risk register, but it's not being conveyed. So I think that's the point you're making. So yeah, take that on board, definitely. Duncan, do you want to come in?
Yeah, I was just going to comment on that particular point, and it is a question of whether, because the Audit and Risk Committee is delegated certain functions by the IJB. And one of the advantages of doing this across two IJBs is seeing differences in practice. Now in Mid-Lothian, the Audit and Risk Committee have the chair report in on the activities of the Audit and Risk as a standing item on the IJB board. And therefore it's the chair of the Audit and Risk Committee that's then feeding back the appropriate elements from the Audit and Risk Committee that the board might be interested in. So I don't know whether that's something that, from a governance perspective, that the IJB may wish to consider. Obviously, what Mike's doing in there is there, and there is, you know, theoretically a need for the Audit and Risk Committee to actually provide that at least once a year back into the board. With an understanding of what it's been doing, so something to pick up, I think, potentially in that governance space around how the board operates and what information it's asking from the Audit and Risk Committee, having delegated down. Obviously, all of the papers, including all the risk reports, are freely available to not only board members but the general public. On the council website, so all of that information is available to all board members at any time.
Yeah, I think, but no, I think that's well said. I think in terms, Elizabeth would be delighted to be presented, you know, as chair. I think that's probably the right route. Actually, to be honest, I think that's a reasonable approach. You know, I don't think kind of just because it's on a website somewhere is it covers it. To be honest, because I think we're all busy people, and just I wouldn't know when it's on there. When would I look? You know, you have no idea unless someone's telling me when it's been loaded up. So I think personally, I think it should be the key elements, and should be, or the key risk should be raised at an IJB level. And that, like you said, there's different ways of doing that, but that would be my sort of my own view on it. I'm just a lone voice. It doesn't matter, but just my view.
Sorry, just before we go any further, we've lost our chair. Could we just take a break for
That's
a
good.
couple
Just tell
of
us
minutes?
we're given a jobs. We're given a jobs, Rebecca. It's fine. just let her.
If we could just take a quick break, because the meeting recording is ongoing. So if Alana, would it be possible for you to pause? I'm just going to send Alana a message to ask her to pause, but if we just stop for a moment.